Ms. Williamson, we've been talking a lot about access to health insurance, but for many Americans, their most pressing concern is the high cost of health care. How would you lower the cost of prescription drugs?
Well, first of all, the government should never have made the deal with the big pharma that they couldn't negotiate. That was just part of the regular corruption by which multinational corporations have their way with us. You know, I want to say that while I agree with, I'm with Senator Bennet and others, but I agree with almost everything here. I'll tell you one thing. It's really nice if we've got all these plans, but if you think we're going to beat Donald Trump by just having all these plans, you got another thing coming. Because he didn't win by saying he had a plan. He won by simply saying, make America great again. We've got to get deeper than just these superficial fixes, as important as they are. Even if we're just talking about the superficial fixes, ladies and gentlemen, we don't have a health care system in the United States. We have a sickness care system in the United States. We just wait till somebody gets sick, and then we talk about who's going to pay for the treatment and how they're going to be treated. What we need to talk about is why so many Americans have unnecessary chronic illnesses, so many more compared to other countries. And that gets back into not just the big pharma, not just health insurance companies. It has to do with chemical policies. It has to do with environmental policies. It has to do with food policies. It has to do with drug policies.
Thank you, Senator.
It has to do with environmental
Senator
policies.
Bennet.
You look at my whole health plan. Yes, we provide universal health care, but we need to do more than that. We need to ask, how come so many of us are so sick? How come in the United States today we have such a higher level of chronic illness than they do in other countries? Why is that? Why is it? I'll tell you why. Because of the contaminants in our water. It's because of the carcinogens in our food. It's because of the toxins in our air. To a great extent, it's even because of our economic policies, given how much stress it causes the average American. And so we need to realize, you know, in France, McDonald's can't even make the same French fry in France that they make here, because France would protect their food supply more than they do here. But see, in order to address what's really making us sick, the political system, the political establishment, and by the way, some very, very nice people. This isn't about not nice people. It's about a system itself that is so corrupt. Of course, they're only talking about treating the symptoms and providing health care, because if they were talking about root cause, which is why are we so sick, we would begin to realize with the political establishment as it is, that the reason they don't want to talk about root cause is because they are the root cause.